As Ava said, my job is to set the stage, and I want to begin with a series of maps that the CDC put together years ago that are based on the Behavioral Risk Factor Surveillance System, which is a telephone-based survey of the US population. All of these maps have a key at the bottom, which indicates the prevalence in terms of color. So no data are these white states. A prevalence or frequency of obesity of 15 to 19% is this dark blue. All of these data are from adults. This is an annual survey, and I'm going to skip a couple of years just to give you a sense of how rapidly this epidemic has spread across the United States. So this is 1991, 93, 95, 97, 99, 2001, 2003, 2005, 2007, 2009, 2010. These are underestimates because these are self-reported data, and like everyone in the room, people overestimate their height and underestimate their weight. So the true prevalence in adults is about 34%. Now, we don't have quite the same data in children, but we do know that the prevalence in children and adolescents has increased rapidly. These are data from children 6 to 11 years old boys. And you can see that these are measured data, so they're accurate. About 17% of the pediatric population is obese, defined here as a BMI greater than the 95th percentile, based on standards prior to 1994. Notice the disparities that exist. The highest prevalence is in Mexican-American boys, followed in descending orders by non-Hispanic blacks, and finally non-Hispanic whites. Quite a different ethnic distribution exists among girls. The highest prevalence here is in non-Hispanic blacks, followed by Mexican Americans, followed by non-Hispanic whites. Now, one of the interesting phenomena, and this is depends on the range in which you look at these data, and Claire will spend more time on this. But there appears, at least in the most recent data, to have been a plateau among girls. This has been relatively flat since 1999-2000. In contrast to boys, in which the prevalence still is increasing. And the scale of this, how you interpret these data depends on the scale. I prefer to think that this means that we're at a plateau within girls and at a potential turning point. We still have to control this problem in boys, and that's part of the challenge. Obesity is not a problem limited to the US population. These are international data. I hope you can see the scale, but the United States is among the heaviest of these countries. Malta beats us by just a little. But you can see that all countries are affected to a different degree. And when you look across time, the obesity epidemic is occurring everywhere. And the interesting observation is that where countries have multiple data points, the slope appears to parallel that in the United States. And as in the United States, other countries also seem to be at a plateau. The most promising data in the United States are that several states or communities are now showing a decrease in the prevalence of obesity. And those are states which have employed a multi-component level intervention, and that's a theme that we're going to come back to. This is an expensive problem. The consequences of obesity are cardiovascular disease, cancer, and type 2 diabetes. And our estimates in 2009 were that this accounted for about $150 billion a year, or almost 10% of the national healthcare budget. And there have been studies published since this study that indicate that that may be an underestimate. These costs also don't account for absenteeism or what's called presenteeism, that is underperformance at work, which is at least as costly as the direct medical costs of obesity and maybe more. Now, the question that we're going to focus on today is what changes in the food supply, or what characteristics of the food supply could account for this epidemic. A very nice study published by the Harvard School of Public Health last year shows that a variety of food consumption patterns appear associated with increases in body weight over this 12 to 20-year period. So this is the Nurses' Health Study and the Health Professional Study, which are longitudinal data, self-reported. But notice that people who increased their weights had increased intakes of processed meats, unprocessed meats, as you might expect, sugar drinks, which are soda and 10% juice, and potatoes and refined grains. Whereas foods that contain whole grains or vegetables or fruits were associated with better weight control and actually weight losses over that same period of time. Now compare those data to what we see in the general US population. The foods that we should eat more of, and on this list are the whole grains, vegetables, fruits, low-fat dairy, which accounted for a decrease in weight over this period of time. Americans consume far less of those foods compared to the foods that we should be eating less of, which are solid fats and added sugars, those fast foods, sodas and so forth. We're over-consuming substantial amounts of those foods. Now, when you look at young children, the data become pretty disturbing. You can see here that young children are already, and these are toddlers, these are children up to the age of 4, already have excessive intakes of sodium, excessive saturated fat intakes. About a third of children consume no vegetables on a daily basis, a third consume no fruits on a daily basis, a third of children are consuming pre-sweetened cereals. Their high caloric density foods are frequently consumed as snacks, and about a third of children consume a sugar drink on a daily basis. So together, those data from the foods that are associated with weight gain and those that are associated with weight control, the consumption patterns of the US population, the consumption patterns of children, really should serve to focus us on several appropriate strategies for weight control. I'm only going to focus on these. The pregnancy-related changes are significant. These are ones that I think need to be addressed on a medical basis. But these are the strategies that we believe will reduce energy intake. So decrease the intake of high energy density foods. These are generally fast foods, foods high in fat and sugar. Increasing fruit and vegetable intake will help displace the more calorically dense foods. And satiety appears regulated by volume as much as anything else. And so fruits and vegetables have few calories and large volume. Sugar drinks, as Claire will share with you, are a huge source of excess calories in the diets of children and adolescents. And depending on which study you read, they're either the highest source of excess calories or pizza is the highest source of excess calories, but they're pretty close. Television time is listed here as a factor which increases energy intake and therefore should be reduced. And I think we've made a mistake over time by labeling this television time. It's really advertising time and food marketing to children, which is now ubiquitous. And not only is it on television, even though television advertising has most recently declined, but use of social media and these broad platforms that unite digital marketing with social marketing and viral marketing are pervasive and intrusive, and parents don't know about it. So advertising is really at the heart of many of these food consumption patterns, given the fact that advertising is what promotes high energy density foods, fast food restaurants, promotes sugar drinks, both directly and indirectly. And that advertising, the food marketing directed to children, is what's at the heart of it. So I'm going to pause there and turn this over to Claire, who will share with you what the target in terms of calories ought to be.
So let me just start by thanking Bill for setting this stage for us, that the trend of obesity both in adults and in children are quite dramatic in the United States. But thinking about how we got here and how can we turn this around is this energy gap framework that I wanted to propose to you, to think about where are the opportunities for prevention. And prevention has to be achieved at the population level, community level, because we know that weight loss programs and dieting or even bariatric surgery alone would not be enough to turn this around. All right. So currently we're looking at the trend at 36% of adults are considered obese. 6% of adults in the United States are extremely obese in the extremely obese category. On the other hand, we also look at a new generation of children. 17% of them and adolescents are currently considered as obese. It was the most obese generation that we've seen historically. So some have projected that this is the first generation who will be outlived by their parents. They will live a shorter lifespan than their previous generations because of the health consequences that associated with childhood obesity and adult obesity. So the trends of increasing childhood obesity, as you can see here, I started the time course since the early 70s. At the time, 5%, 5 out of 100 children are considered in the obese range. And today we're looking at over 15% of the children. And the trend is pretty much a straight line up. In 2010, the nation has set a goal to reverse the childhood obesity to its 1970s level to 5%. That's the red line you see there. Unfortunately, we didn't achieve that. The trend continues to go up, and currently we're hoping that by collective effort and many initiatives that's ongoing, we will be achieving the Healthy People 2020 goal. That is symbolized by the grayish line there you see there. The orange spot that just showed up is the latest data point. And as Bill pointed out, there are some early signs of flattening off in terms of the increase in childhood obesity rates, but obviously more needs to be done. So what is causing the rise in obesity? And we are already conscious about the health consequences if the trend continues to go on, the healthcare system, and also the social mobility, and when you look at children, academic performance, and their the future trajectories of success is part of the equation. So obviously this is a really important question. On the other hand, many people say this is a complex issue, and that's easy to see. So we know that the childhood obesity is a result of energy imbalance. We eat too many calories and we couldn't burn them off. The energy intake and energy expenditure is driven by our patterns of food, beverage intake, and physical activity, which was influenced by the larger environment. And there are many, many factors that influence this. So this was put out in 2004 by the Institute of Medicine in thinking about what are the drivers and determinants and the larger environment issues that drive our lifestyle that's so different from, say, 30 years ago. Some of them we can change, some of them we won't change. We will never have the opportunity to take, for example, electronic devices away from our children today, because that's not going to go away. But let's think about their genetic issues, their personal factors, but we're really largely driven by the environmental settings, such as how our community is set up, how our built environment is set up, even the transportation and how the food system, the food supply that surround us with many of the energy-dense but nutrient-poor foods that's so easily accessible and cheap. That has been driven our energy balance behavior for a large extent. So thinking about these factors will help us think about the potential solutions and places we can intervene. So this is what the British people did. They said, well, there are so many things that we need to intervene on. Everything is connected. And so what was presented here is, in the obesity research community, often referred to as a spaghetti map, because it looks like spaghettis. There is so complex, and it's really important to see all the connections and all the influences. At the same time, I also wanted to say that saying that this is a complex system approach sometimes paralyzed us from taking actions. And so I think going from here, sometimes less is more. So this is what we did about 7 years ago in thinking about, so the fundamental question is, where did we get here in the first place? How many calories a day are we talking about that drove the rise in childhood obesity? So we started thinking, well, but we want kids to gain weight because they're growing, but it's the issue of gaining too much weight. So let's see if this is the body weight distribution of a cohort of kids. And we said, well, 10 years later, they should grow up, just, they're growing taller, they should just grow proportionally. And then we compare that hypothetical body weight distribution with what we observed, which is a lot bigger that is basically the representation of a childhood obesity, we quantify how many pounds and how many calories that represent. And we found that in that paper, so for an average US teenager, over 10 years' time, when they're between their 2 to 7 years old to 12 to 17 became a teenager, an average American teen has gained about 10 pounds in excess to normal growth. So that's in addition to what they should be gaining. An overweight teen, so who became an overweight adolescent, they have gained approximately 6 times more weight than an average American kid. And underlying those excess weight gain is the energy gap. That's the imbalance, that's a surplus of energy intake exceeding energy expenditure of about 110 calories to 165 calories for an average American teenager. But for those teenagers who became overweight during that 10 years time, it was a lot larger. So it's about 600 to 1,100 calories a day. So that's a more tangible number. But why is this useful? So this average daily energy gap is not designed to deal with individual children, because we all know that everyone is slightly different and your kid might be different from your neighbor and so on. So this is not designed to look at individual children who showed up in a weight loss clinic, for example. And yes, there are good calories and bad calories that Bill was talking about. However, I wanted to propose this framework as a 20,000 feet level to think about, on average, how many calories we're talking about and why this is useful. So the first reason it is useful is just how we can think about setting national goals. I mentioned Healthy People 2020 goals early on in my talk. At the time we're setting, for example, we wanted to achieve 5% obesity prevalence in 2010, which we did not achieve. And now we're looking at, we wanted to achieve this level that's represented by, again, this HP 2020 goal that's 10% lower than what we saw in 2005, which is very useful in tracking where we are going as a nation, but in terms of what are we supposed to do, it's harder to understand. So using the energy gap framework, we translate this into how many caloric reductions a day we have to try to achieve on average in order to get there. So as you can see there, this in our very recent paper, is about 64 calories a day of energy deficit or energy gap that we have to produce from actions to reach people, to make them exercise more and eat less harmful calories in order to achieve the childhood obesity Healthy People 2020 goal. If we wanted to achieve the 2010 goal by 2020, we will have to cut back an additional 120 calories. So that's just a way of translating a prevalence goal that's less tangible to something that's more understood and more tangible in terms of actions. So how do we go from there then? So how do we achieve a 64 calories cut on a daily basis? So at a community level, we can think about, well, maybe we can structure our environment to be more friendly to active living. So we can walk around the neighborhood, we could be there are more playgrounds and so on. Maybe we can structure a healthier eating environment so that there are fewer sugar-sweetened beverages lying around as the default drink for, let's say, playing basketball afterwards. The energy balance needs to be taken into account. Many people talk about the potential of schools. However, we really need to ask, well, is school the only option that we can intervene on? And I would say no, because kids spend on average 180 days in schools. So the rest of the year, they're exposed to the home environment. So more needs to be done beyond schools. So we asked the question of, well, if we're going to intervene on taking away the sugar-sweetened beverages, they, on average, American kids consume about 300 calories a day from these beverages, and only 15% coming from schools. So the other 85% are from their homes and their friend's house. So more needs to be done there as well. But at the end of the day, we also wanted to ask the question of, so when we have this common metric, can we compare program A versus program B instead of saying, you know, we do not want to. We do not want to structure the food environment because we need to have more PE classes. So the fallacy of the argument is, well, the scale is lost in that statement, and let me explain why. This is a recent tool that we built. It's called Caloric Calculator, and feel free to play with this tool a little bit. But you can look at doing different things will result in different impact in terms of average calories. So for a typical US boy in middle school, cut out daily canned soda means 140 calories. Replace sugary drinks with water in schools only means 15 calories a day. Because they're only in school for part of the time. Walking for 50 minutes, 135 calories, and increasing PE from 1 time to 3 times a week actually only means 26 calories a day when you average across the week and during the year. So it's really important to think about, well, what is the reach and what is the effectiveness, and also the frequency and intensity. These are all part of the equation. So. I wanted to propose using this ACI as a way for us to think about all these opportunities that we're brainstorming on how much we can achieve. And instead of saying, I heard a lot of pushback when we were at the portion size cap discussion that happening in New York, that we should not talk about regulating in the food environment. We should have more walkable environment. We should have more bike paths and so on. So that's why we talked about this metric and say, well, what is 16 ounces of soda that is considered small in McDonald's at this time, which contains 150 calories, about 10 teaspoons of sugar. For a middle school kid, that means walking for 60 blocks. That's Columbus Circle to Apollo Theater. And if you say we wanted to add PE as the right thing to do, then you should be adding 100 minutes of PE in order to burn that off. So scale really matters, and thinking about the magnitude really matters. And I want to close by mentioning the healthy weight commitment. That is over 200 retailers and food companies, they got together and announced by Michelle Obama they pledged to reduce 1.5 trillion calories annually. And then you can calculate how much of that calorie reduction would be trickled down to each individual children. And our preliminary result shows about 7 to 20 calories a day. It's not enough by itself, but it's substantial. And I hope more people will be thinking about it this way. And I want to thank a lot of contributors and my colleagues. And I'm happy to take questions either through email or after this panel. Thank you.
Thank you all for having me here. I'm looking forward to speaking with you about our experiences using research to try to improve corporate marketing practices. In 2005, the Institute of Medicine came out with a seminal report. They looked at all of the research on food marketing to children and adolescents and the effects, and what they found was that there's a lot of marketing targeting children. It almost exclusively promotes products that are high in calories, sugar, sodium, and saturated fat, and it's affecting children's food preferences and probably affecting rates of obesity as well. That report got a lot of attention and raised a lot of concerns, as well as other reports going on around the same time. And in response, the food industry came up with the Children's Food and Beverage Advertising Initiative, which is their self-regulatory program. And their goal is to shift the mix of foods advertised to children under 12 to encourage healthier dietary choices. Now the program was it was rolled in over a couple of years, but it was fully implemented by January 2008. And today it's still in place, and about 16 companies participate, which is about 90% of all food marketing to children and adolescents. So what kind of effect has this had? Well, we've been tracking advertising seen by children and adolescents over many years. And the axis is number of food ads viewed by people on average every year. So if you look at 2004, the yellow line is the number of food ads that children saw, a little over 12 ads per day in 2004. That was really the peak of advertising to children. And then with all the attention that was paid to the IOM report and other things, there was a decline up until 2007. Then, if you recall, January 2008 is when the CFBAI was fully implemented, and since that time there's been an increase. So the kids are seeing 10% more food ads on average than they saw at the beginning of the CFBAI. The other thing to note is the blue line, which is adolescent exposure, and adolescent exposure to TV advertising has increased by 23% since 2007. And so, it's possible that companies have improved the products that are advertised to children, even though they haven't reduced the quantity. And this report from the FTC did that just came out in December shows the products that are marketed to children. Now, about 40% of all marketing expenditures are for TV advertising, but the other 60% is marketing in schools, digital marketing, social media, promotion, sponsorships. There's a long list. And companies spent about $1.8 billion in total in 2009 to market foods to children. The fast foods is the biggest category that's marketed. The numbers for children include the cost of toys with kids' meals, so that's why that number is so huge, and the teen number is a little bit lower. But beverages are the second most highly advertised category. These are primarily carbonated beverages, but also fruit drinks, like 10% juice drinks targeted to kids, as well as sports drinks, and energy drinks targeted to teens, all high in sugar. Cereals is the third most commonly advertised product to teens and the second to children. Then comes snack foods and sweets, which includes candy. And then about 10% of all this marketing is spent on all the other categories, which includes baked goods, dairy, meals like SpaghettiOs, I'm missing one, fruits and veggies and dairy. So the 10% is on the healthier things as well as some other unhealthy things. So in our opinion, this isn't enough progress, that it's going to be impossible to turn around childhood obesity when companies continue to push the most unhealthy products on kids. So at the Rudd Center, we try to use our research to encourage companies to change their practices. We do the research and then we try to communicate it, and our primary audiences are legislators and parents. And Tracy will talk about the legislative side of things, but I'm going to talk about our strategy to inform parents as a way to put pressure on the food companies, because most of the sales of these products are purchased by parents, and so if they decided to stop purchasing these products, then companies would be forced to change their marketing practices. To do this, we have we have a strategy where we're focusing on specific product categories, and the reason that we do this is because there are so many different kinds of marketing out there that it would be pretty difficult to document everything that's going on for all food categories. So we've produced our facts reports since 2009 that focused on the three product categories that are marketed most often to kids. And I'm going to give you a little bit of a case study on our cereal facts report. We launched it first in 2009 and then did a 2012 update to show how companies have changed practices. So in 2009, what we found was that the cereals that are marketed to children are less healthy than the products that are marketed to adults. They have more sugar, less fiber, and more sodium. And the reason we focused on the cereal industry is because unlike other product categories, they actually have products that are healthy, that they could instead be marketing to children. And even children's cereals, there are healthy children's cereals like plain Cheerios or Chex or Frosted Mini Wheats, but those products aren't marketed to children. Those are marketed to their parents. You see that's the list of the products that are marketed to kids. We've also done a series of studies about the impact of marketing, and I won't go into these in detail, but our research with parents has shown us that informing them about how much marketing there is and how unhealthy the products is important because they don't understand that. But there's also a general belief that marketing doesn't affect their kids. So actually most people believe marketing doesn't affect themselves either. But so the research, so we also do a number of studies to show how marketing actually does have an impact. We supported this with an extensive communications campaign, and one of the risks going into this research was that people would just say, so what, but that didn't happen. Every time we produce these reports, we get a lot of coverage, and this is news about how unhealthy these products are. We also created resources for parents to help them find healthier options, and for example, our Cereal Facts website has had more than 95,000 unique visitors since we launched it, and then we do policymaker outreach as well. So the industry did respond to our cereal study. Well, the first thing they did was launch a huge public relations campaign saying how healthy their cereals are. But after that, both General Mills and Post announced that they were going to reduce the sugar in their children's cereals. And then I think the most significant change that we've seen is both Post and General Mills discontinued their AdverGame websites. And AdverGames is one way that companies target kids. These are all branded games on the internet. And Millsbury, which was the General Mills site, had over 300,000 unique children visiting that site every month, and they were spending 60 minutes per month on it. So this was a pretty significant development. Last year we came out with our update, and we did find some progress. The nutrition of children's cereals did improve slightly. This is on a scale of, this is a nutrition standard on a scale of 0 to 100, so they improved from 37 to 42 in the past few years. But if you look at the cereals that are marketed to adults and the cereals marketed to parents for their children, the children's cereals are still significantly worse. Cereal advertising on television has also gone down during this period. And just to give you some perspective, this is the numbers for a few other categories. So packaged goods in general has remained flat, and but restaurant foods and candy specifically have risen pretty dramatically at the same time. The cereal companies still have a very long way to go, though. They continue to advertise their worst products to children. There's continues to be more cereal advertising than any other packaged goods. Only fast food advertising exceeds cereal. Another disturbing thing that we found is that the cereal companies changed who they're targeting for their products. So in the past few years, they've increased the number of ads that are targeting 12 to 14-year-olds, considered the tween market. So they've moved to slightly older children. They're also targeting parents much more, and the messages in those ads are very much you know, these are healthy products to serve your children. And this is the list of products that were advertised most extensively to children in 2012. And these are all at least 1/3 sugar content, with 1/2 serving of whole grain. So I'd like to thank our funders and my colleagues for helping with the research.
Thanks, Ava and Aaron. It is a pleasure to be here, and I always love going last on a really impressive panel because I can pretty much start by saying, in summary, everything that is said is great. But I am going to talk a little bit, kind of shift gears a little bit and talk about some of the federal policy drivers and initiatives going on that I do think impact industry and private sector businesses quite a bit, and they're oftentimes paved the way for a lot of innovation in the private sector. And then also a little bit about some of the barriers and challenges that we have seen over the last several years in our efforts to really promote healthier food environments. So in terms of the federal drivers, there are several more than what's on this list, but these are probably 3 of the main ones that I think we've seen some action on lately, and I hope that we see even more action in the months and years to come. So national menu labeling, school foods, all the different foods and beverages provided in schools through the meals and the snacks, as well as front of pack nutrition facts labeling. So I'll kind of go through each of those briefly. Menu labeling, the Affordable Care Act that was passed into law included a really important provision that would make it mandatory for chains with greater than 20 stores to require menu labeling, basically just calorie labeling either on the menu board or on the menu. So that was a provision that was in the Affordable Care Act. The Food and Drug Administration, that's the agency that's responsible for implementing that part of it, did issue proposed regulations basically outlining how they envision that part of the bill being implemented. So those proposed regulations were pretty good. There were a couple of things that the public health community and the nutrition community complained a little bit about, but you're always going to find that. We really wanted to make sure that not just chain restaurants, but things like pizza places and movie theaters and bowling alleys, grocery stores that offer prepared food were also covered. So FDA's in the process, we hear, of finalizing those regulations. I think there's a little bit of squabbling among the grocery chains and the pizza chains and the movie theaters, trying to basically point fingers to say that they don't have to be covered, whereas the restaurants do. So we hope that the definition is pretty broad in what they cover, but that'll be pretty huge because it really will require that chain restaurants provide this information, which is now, you see it in New York City, you see it in California, you see it in Seattle, King County, but there are clearly a lot of places that don't have menu labeling, so that'll be an important step forward. School meals and snacks, we've probably seen the most progress in this space over the last several years. The United States Department of Agriculture is the agency responsible for implementing school meal standards, and they just came out with final regulations about several months ago that are now phasing into schools that really updated the nutrition standards for the school lunch and school breakfast, and that was a really huge step forward. So more things like fruits and vegetables and whole grains and low-fat dairy are in schools across the country now. And just last week, actually Friday, they introduced, the U.S. Department of Agriculture also issued a new sort of proposed regulation that would address not school meals, but all the other snacks and beverages that are in schools and vending machines and school stores. So that's a pretty big deal. So we can really see down the road the potential for the school environment, all of the foods and beverages, to be really healthy and nutritious. So that's been a big win. We wish we could see more of those wins in the food marketing area and other areas, but we do see a lot of progress in schools. In terms of nutrition facts and front of pack, how many of you read the nutrition facts religiously when you go to the store? Excellent. FDA would like to see everybody in the room raise your hand on that one. So they're actually making some, at least indicating that they might be revising the nutrition facts label to make it even more readable than it is now, and doing things like instead of just listing information for a portion size, they would also list information for what's in the entire package. So, which is a huge step forward, because how many of you, I know none of you have any potato chips in your house or near you, but how many of you, if you were to pick up a bag and it said, you know, this bag has 25 portions in it, it's like, wow, I just whipped through most of those in a sitting. So they are going to try to make it a little more reasonable and a little more, basically a little more consumer friendly in terms of what we actually eat and consume. And then there's also something, that's kind of the back of the pack, we call it. And there's also something called the front of the pack. And you might see this, you might not. It's more of an industry-driven initiative at this point, where sometimes you'll see an icon, a label, something that prompts you that says this is a more nutritious item. So we see a lot more front of pack initiatives springing up. And FDA might decide to take on the front of pack world. We're not sure. I think in the meantime, it offers some opportunities for businesses and grocery chains to step into that space. And then Jennifer talked about the Children's Food and Beverage Advertising Initiative, and one thing that Bill was very intimately involved in was something called the Interagency Working Group on Food Marketed to Children, and that was a working group that was comprised of 4 different agencies, and Bill was the lead when he was at CDC, representing CDC's interest in that working group. And it was really tasked by Congress to establish voluntary guidelines that food and beverage companies could follow to really update and increase the standards for healthier foods and prompting them to market healthier foods. So the interagency work group came out with these great guidelines. They were all totally voluntary, not a requirement at all for food and beverage companies to adhere to, but it was just leveling the playing field, because really until then, there's a whole patchwork of standards out there. So amazingly, the food and beverage companies just did not like that at all. They really, and I'll talk a little bit about the amount of money they spent to counter those efforts, but that was sort of a federal effort underway. It has since been stalled, and Congress intervened a little bit and really basically wouldn't let the interagency work group continue to do their work, unfortunately. And then Bill left, so there you go. So in terms of some of the private sector efforts, and I don't want you to think that there's the federal policy efforts and there's private sector efforts, because they're two very interrelated sort of things going on here. So, for example, these can kind of be broken out into 3 main areas: kind of what food and beverage companies are doing, what restaurants are doing or can be doing, and then what grocery stores are doing. So in terms of the restaurants, we talked about national menu labeling, which we hope will come down the pike, and McDonald's has actually already voluntarily on their own decided to do their own menu labeling across the board for all their products. They announced that last September, and it was in the stores within a week. So nice to see industry can really turn on a dime whenever they need to. They kind of fought menu labeling for years until they were for it, and then they unveiled it within a week. So pretty amazing. And there's also a Kids Live Well initiative, which is sponsored by the National Restaurant Association, which basically includes, I think, 35,000 locations abide by the Kids Live Well sort of criteria, which basically means they offer healthier kids meals, and they will market more heavily the healthier kids meals. So it's a step in the right direction. I think we could squabble. I'm a nutritionist by training, so I can always squabble on some of their nutrition criteria that they have, but at least it is raising awareness, and they I just learned last week they're going to be unveiling a lot more brands that are going to be joining the Kids Live Well initiative, so that's a good thing. And then Jennifer and I and others were involved in something that the RAND Corporation was doing to develop performance standards for restaurants. So this would also kind of along the lines of Kids Live Well, except that it applied to adult meals as well. And it's really just an effort to design performance standards so public health, nutrition advocates, et cetera, could go to a restaurant and say, why don't you abide by these performance standards, and then we will give you a check, or we'll promote you, or whatever the case. So we're hoping that once those are finalized, more companies will step up to the plate, or more restaurants. And then I talked a little bit about front of pack. I don't know if you've been to a Walmart lately, they're going to be unveiling their Great For You initiative, which is pretty good, strong nutrition standards. That icon will only appear on certain food products. Hannaford Brothers, which is located in the New England area, as well as Food Lion, has the Guiding Stars initiative. We're seeing more and more of those crop up. Some of them are really good, some of them are not so good. So we're pretty selective in terms of which ones we would recommend that a company would go with. And I'm happy to chat offline about which ones I think are pretty good. And Jennifer mentioned the Children's Food and Beverage Advertising Initiative, which is basically an industry self-regulatory program where companies, food and beverage companies, will develop pledges, which basically amount to they'll design standards, nutrition standards for their products to abide by, and that's what they'll stick to in terms of marketing for kids. One of the things I do think came out of the interagency work group, that sort of thing that ended up being an absolute disaster because industry didn't like it, was that it did, I think, prompt the Children's Food and Beverage Advertising Initiative to ditch their 17 pledges that they had from the 17 food and beverage companies and come up with one uniform standard. So a step in the right direction. We do know that the standards, again, there are some loopholes in there. They would allow things like popsicles and SpaghettiOs and some other things that you wouldn't normally think of as healthy products that you really want to push to 2 to 11-year-olds. But at least it's a step in the right direction, and it did prompt some changes in that space. Those are supposed to be implemented by the end of 2013. So in terms of like what has been the impact of all of this industry self-regulation, has there really been a positive impact? And we're seeing some glimmers of hope in this space. Hank Cardella has done some nice research looking at sales, looking at companies that promote healthier products. If it's more of their portfolio, they actually end up increasing in sales. So he released a report last year that found that between 2007 and 2011, the better for you products in companies were about 40% of the sales, yet they represented about 70% of the sales growth. So basically, the better your portfolio is in terms of healthier products, the increase in sales you're going to have. And tomorrow, he's going to be releasing data that he's done on restaurants, looking at those restaurants that have a larger portfolio in lower calorie products. And I would imagine you're going to see a trend in a similar direction. In terms of food marketing to kids, I'm not going to touch on this too much. I think Jennifer did a nice job. We've seen some areas where we've seen some positive trends, but we've also seen areas where the food and beverage companies are shifting their dollars. They're going from, instead of promoting foods to 2 to 11-year-olds, they're actually shifting it up to 12-year-old and higher. So we're seeing some of those unfortunate trends that they're just basically, in order to comply with the 2 to 11-year-old sort of requirements and standards, sure, they could just dump a lot more money into the 12-year-olds. I know as somebody who raised 2 kids, when they were 11, they didn't just only watch programs geared towards 11 and younger. In fact, the majority of programs probably were for that tween market. So we do also see fast food ads for non-kid meals increasing. And again, more kids are not eating the kids' meals, they're eating the other value menu, et cetera, and we're seeing more of the marketing go towards there. So, and what has been the impact in terms of industry spending money countering some of the public health efforts that we've talked about? Well, it's been pretty significant. Ever since President Obama took office and his wife sort of went on the Let's Move initiative, industry has doubled their spending to counter a number of the nutrition and public health advances that we've tried to make. And CSPI, the Center for Science and the Public Interest, is probably the big public health watchdog organization, spent about $70,000 in that same period of time. So for every 13 hours that the food and beverage industry is lobbying, that's about the entire budget for the Center for Science and the Public Interest. So we're sort of out-financed in the space of really advocating for our issues versus what the food industry has done. In New York State, wow, you guys are pretty flush in funding because you're having a lot of food and beverage companies pouring lobbyist money into the state to counter a lot of the efforts, certainly that your mayor has undertaken and that have been proposed at the state level as well. We also know, I mentioned that the USDA updated their school meal standards. One of the things that they wanted to do, amazing, is they wanted to limit the amount of starchy vegetables that were served at lunch, basically French fries. French fries is the #1 vegetable served on school menus across the country. Practically every day, walk into any school and you will find French fries. So USDA just wanted to limit it a little bit to maybe 2-3 days a week, and limit also tomato sauce on pizza. It was sort of a thing that they were trying to fix. Well, the potato and the pizza industry came down hard on USDA and basically convinced Congress to weaken some of the regulations that USDA had on the books. In terms of sugar-sweetened beverage taxes, a lot of funding goes towards countering any kind of sugar-sweetened beverage tax. So in 2009, there was a little bit of talk at the federal level even to put a tax on sugar-sweetened beverages, and the food and beverage industry spent about $40 million to counter that, and they only spent about $5 million the previous year. So it was clearly specifically targeting that. We see the same thing across the country in states across the country. 24 states in 5 cities tried to introduce legislation to put a tax on sugar-sweetened beverages. One of them passed, and then it was overturned a couple months later. $16 million went towards that. Just in Richmond and El Monte, California alone, they had about $3.5 million spent by the beverage company to overturn and basically to repeal or to vote down taxes. And then of course, you never want to see yourself on the front of anything, and certainly not looking like this. And certainly Mayor Bloomberg and was certainly a big target for a lot of the funding, and they had really slick ads and really effective ways of getting to people. So we are definitely out-financed in this space, but that doesn't mean we're not committed to kind of furthering the efforts that we know we can do. So a couple things in terms of what we can do, and I do think that even though we have some concerns about some of the standards as part of the Children's Food and Beverage Advertising Initiative, we still need to push companies toward there and push the Children's Food and Beverage Advertising Initiative to strengthen their self-regulatory standards. Would like more media companies to follow suit. Very few. Disney is probably the best example of a media company that's been really responsible in their marketing, but they stand out. None of the others really have. Support only strong front-of-pack initiatives. Build evidence base that healthier foods are good for the bottom line. The Hank Cardella work that I just talked about. Support federal efforts like menu labeling, SNAP foods in schools, etc. There's going to be a lot of industry pressure, I would imagine, with the new regulations that just came out from USDA. So we really hope that there's a lot of corporate responsibility out there, if you will, to really abide by the regulations that USDA has proposed. And then, of course, supporting local advocacy efforts, whether it's supporting sugar-sweetened beverage taxes or other local efforts like the cap on the beverage size in New York City, et cetera. So with that, I'll turn it back over to Ava. Thank you.